Welcome back to Vital Signs. If you're just tuning in, you're going to want to go to nowmedia.tv, click on shows, go to Vital Signs and catch the first half of today's show because it was epic. Remember, this show is for educational purposes only. It is not medical advice. Always seek the advice of your healthcare practitioners prior to changing your routines. And we're going to shift gears now and talk about our veins, the health of our veins, and the latest in medical treatments for anything that might be going awry. We are joining Dr. Andrew Doe, founder of Alate Health, board certified interventional radiologist. Welcome back to the show, Dr. Doe.
Thank you. Thanks for having me.
So let's just dive in. What do we need to know about the health of our veins? Why is it such a critical aspect of our overall health and well-being?
So the biggest thing that people don't realize, about 40% of people in the world will have some element of vein disease. And anything that can decrease your ability to walk and maintain an active lifestyle is something that you really want to pay attention to and get fixed if you have it.
Thanks for that. And so when we're thinking about this, what are some of the common signs and symptoms that something's not going well for us? Are there early warning signs that people can watch for? And if we see something, when is the right time to seek medical attention?
So most people are confused thinking if I see a spider vein, something like that, it must be cosmetic. However, if you find yourself getting home at the end of the day and saying, "Oh, I can't wait to put my feet up," that's usually a sign that there's some venous disease. And, your legs feeling tired or achy, cramps at night is another good indicator. All those things can indicate there's some element of venous disease.
So let me just reiterate because it's really important. If I'm feeling like my legs are fatigued, they're tired, I just want to prop them up, that is something for us to really take seriously. And so when we see this, how long does this go on for before we want to be seeking medical attention? Because I just think, hey, I was a runner, a soccer player. There's days when you go and you're putting mileage in and you just need to get off your feet, and it's only one day because you did a hard workout. Like, what is it? Is it a trend? Is it a couple of days? Is it a couple of weeks? Like, what does that look like?
Yeah, so if it's just after a very heavy activity and it's once in a while, probably no need to be concerned. But if it's something where, pretty much every day when you are on the way home, I know myself having vein disease, I'm thinking, boy, I can't wait to get off my feet, get my legs up in the air. If you see that happening, multiple times a week or maybe even every day, that's when you want to really think about, hey, I think I need to get this looked at. Now, swelling, if you have any element of swelling without any reason for it, that's another great indicator to come in and see somebody.
Okay, so I'm just going to reiterate these red flags, folks. If you're having day after day, you just can't wait to get home and get off your feet. If you're having any kind of swelling, it's time to do something about it. And I'm going to ask something because I know I'm going to get this question. What lifestyle factors could contribute to some of these issues? Is it sitting a long time? Is it standing a long time? Is it walking for too much? Like, are there any lifestyle factors involved in this?
So, this is 4 times more common in women, and that's because of pregnancy. Pregnancy really beats these veins up, stretches them out, and then causes these little one-way valves to be pulled apart so they're not working properly. Genetics, female, pregnancies, those are the big risk factors. Now, as far as something lifestyle wise, obviously weight can play a big factor in this. Sitting and standing doesn't tend to make it occur, but it tends to bring it out. You tend to notice it more, especially those, you know, people with occupations where they're standing all the time, hairdressers and nurses and, just people on their feet all the time.
Okay, fantastic. So you told us that women were more at risk for this. Pregnancy is another risk. There are some genetic factors as well. Are there any other people who are really high risk for this? And is there anything that people can do on the wellness side if they are? Let's say I am a female. I just found out I'm pregnant. Is there anything that I can do that can support that venous health along the way?
Yeah, so the biggest thing you can do is compression stockings, and they need to be above the knee. thigh high or pantyhose. That's the biggest thing you can do to slow the progression. Now, if you have a genetic component, the best you can do is slow it. If you don't have that genetic component, then you can probably at least prevent it to some degree just by wearing the compression. But otherwise, walking on your hands is about the only other thing you can do.
I don't know anybody who does that. If you find somebody who does that as a solution, you let me know. So folks, what I'm hearing is it's really important that we pay attention to this, because when we get into a realm of disease in our veins, it can be something that is actually acute and life-threatening. I'm thinking of like deep vein thrombosis, and we may not know, and that can easily cause problems. So talk to us about common things that you see at Alate. What are some of the common diseases that you are treating? What are common things that you're seeing coming in from a symptom standpoint?
So we treat a lot of vein disease, obviously. Um, and in a more general sense, we treat a lot of leg pain. Patients coming in, whether it be trouble pain while they're walking, which will indicate one process going on, or pain after long walks indicates another. Maybe it be joint pain, for which we offer regenerative therapies. Those are the things we tend to see as far as the legs go. We also see a lot of patients for an enlarged uterus, heavy cycles because of fibroids. And then for males, we see a lot of patients for enlarged prostates. We are able to treat all of those things now by manipulating the blood flow and the vascular system.
Wow. So what I'm hearing is our venous system is so incredibly important. Folks, pay attention, because it could actually be something contributing to a lot of other areas. So talk to me about some of the treatments that you guys are doing now, because it's come a long way. I know once upon a time I remember my grandmother having spider veins and saying, I'm not going through all that pain and all of that hubaloo to fix these little things. And I mean, like, honestly, she had DVTs at one point in time. But talk to us about how these procedures have progressed over time, and what do we expect as a patient if we're going to go through some of these procedures?
Yes, so it has progressed quite a bit since the years of the vein stripping. And I tell my patients, when we only had vein stripping, the treatment was worse than the disease. So we don't do that anymore. Now we can go in using ultrasound and small little needles and put in a little bit larger catheter, and then depending upon which treatment is best for you, and at Alate Health will tailor it just for you. These catheters will either let out some glue called Venous seal, which will seal the vein shut right there, or the catheter can get warm, and the heat causes inflammation and causes that vein to scar down. But essentially, what we're trying to do is to shut off that bad vein and to allow the good veins to take over, which is going to improve your symptoms and improve your blood flow in your legs.
And so that sounds a little bit scary, truthfully, to those of us sitting on the couch. You're going to shut down our vein, and we're going to wait for the others to take up the slack. Like, what does the downtime look like, or what does that process feel like as we go through post treatment?
So it's a very gentle treatment. Patients are up and on their feet immediately after the procedure. There's really no downtime other than the fact that, unlike a lot of centers out there, we offer some sedation with your vein treatments. So you'll be very comfortable. Pain will be minimal. And once you finish your procedure, you'll be up and walking and able to move and, do everything you normally do the next day.
Oh, that's fantastic. Because I'm going to be frank. Like, when I heard, oh, I've got to wait for the other veins to take up, I'm like, okay, well, what does that process look like? I know I'm going to get the question, so I just assume asking from the vet. So talk to me, because a lot of times we see the cosmetic things, and I'm just going to speak as a woman. We see maybe a varicose vein or a spider vein, and we think it's a cosmetic thing as opposed to a medical thing. Talk to us a little bit about the treatments for these, and why we need to really pay attention. It's not just a cosmetic situation.
Yes, so if you think of having a tree in the backyard and you don't like the tree, well, you're not going to dislike the tree because it just has one ugly leaf on it. It's going to be because there's something really wrong with it. And these spider veins are usually an indicator of something on the surface, but something that's wrong much deeper. So, if you've got a bunch of spider veins, or especially if you have a big varicose vein, that's something you want to get looked at, and you want to have at least have an ultrasound to see what's going on with the main vein that all of these ones will connect to, because we're fortunate enough to have two systems of veins in our legs, and our venous disease tends to be in large part confined to that superficial system. So even if you just have a few spider veins, it's still a reason to at least have someone take a look and to make sure there isn't a larger process going on.
And then I'm going to ask you the flip side of that is, well, if I have a look and there's nothing serious going on, can we treat them for cosmetic purposes as well? What does that look like?
Yeah, so when we treat the cosmetic side of it, we get a much better result if we know the underlying vein is working properly. And the way we treat the cosmetic end of it is just with some simple injections. Um, we don't use the patients say, oh, those really hurt. We don't use that substance anymore, especially at Alate Health. But we inject those veins, a bunch of tiny little bee stings, and then, in 3 days, you're wearing compression. And then after that, you're pretty much these will just fade over time.
That's fantastic news. So we just heard great news about treating the cosmetic side of venous disease. We will be right back after these messages.